they really gloss over lifestyle medicine, right? So that number one, even though it's listed as number one, generally it gets kind of glossed over because it involves a little more effort on both parties, on the physician as well as the person coming in with an issue.
I'm Heather Grish, and this is the Wisdom of the Body podcast. This podcast explores the idea of body intelligence as the real key to learning the knowledge of life, or what we call Ayurveda in the ancient language of Sanskrit. We do that by connecting with today's creative leaders and experts who will help you listen to your body, trust your gut, and live in deeper harmony with nature. Come join me as we unlock the golden door to clear, direct perception and become very deep listeners. You can find the Wisdom of the Body podcast on Apple, Spotify, and Stitcher. You can also follow us by joining my email at heathergrish.com or on Instagram at heathergrish. I know you're going to love this podcast, so take a second right now to subscribe. Today, I'm here with Dr. Saloni Sharma, who is the author of The Pain Solution. She's both a medical doctor and a licensed acupuncturist and is double board certified in pain management and rehabilitation medicine. She's the medical director and founder of Orthopedic Integrative Health Center at Rothman Orthopedics and has treated thousands of patients. She's also co-chair of pain management and spine rehabilitation for the American Academy of Physical Medicine and Rehabilitation, a popular speaker at Google and award-winning clinical assistant professor at Thomas Jefferson University Hospital. She lives near Philadelphia. Dr. Sharma, thanks so much for joining us today. I'm excited to speak with you.
Thank you so much for having me. I really appreciate this opportunity to talk with you and your listeners.
Well, you know, this is such a huge topic because everybody experiences pain, right?
It is. It's unfortunate. Yeah, it's a universal experience. Just if you're human, unfortunately, at some point you will or have had pain.
Yeah. Some of us more than others, perhaps, or like maybe different points of our lives, we have more pain than others. And certainly if we have some health conditions, we have pain. So this is a topic that everybody really can relate to. I was curious. I read about your background in your book that is being launched right now, The Pain Solution. You've had your own epic battle with pain, haven't you?
Yeah, unfortunately, I had scoliosis as a kid, and I had to wear a brace for about a year. And then from that, I've had, muscle pains and aches. And even as an adult recently, I've thrown out my back. So yes, I am human and I've had experience with pain as well.
And I've not had scoliosis, but could you describe a little bit of that experience for like, why does that get painful for someone? And what are some of the things that people typically do for something like that?
Sure. There's different kinds of scoliosis. There's scoliosis of childhood, which is what I had. And just to be clear, scoliosis is a curvature of the spine, and it can result in some muscle imbalances. So it can give people a lot of muscular pain or spasms at different points of their growth or in their life. And there's also degenerative scoliosis or scoliosis that's related to arthritis and aging. So people can have it at different times. Most of the pain associated with it is related to muscle tightness, spasms, and inflammation. Some of it can be related to, deeper things like joint and disc issues.
So like the older I get and the less juicy the little things between my bones and my spine starts taking a different shape and turning me into a curvy spine woman?
It's possible. So I wouldn't say you're destined to be curvy spine woman, but for some people it goes that way, not everyone. And to go back to your previous question, I mean, the things you can do are really lifestyle things and things that you talk about a lot on the podcast, which is working on your nutrition, sleep, stress, relationships, and, just your activity level as well.
I'm excited to dive into this topic with you today because the pain problem, at least in the United States, and I'm not aware of other countries and, whether they have opioid related death issues the way we have it. But as those have increased, and it sounds like they've increased a lot during the pandemic, the focus of your book, what would be some of the alternatives to something like an opioid that somebody would be prescribed?
Yes, thank you for asking that. It's such an important issue right now. Opioid-related deaths and the opioid crisis has just worsened during the pandemic. And really, we have an opioid crisis because we have a pain crisis. So pain is not well treated here, and people, unfortunately, are looking for just easy fixes to feel better quick, but without really looking at the long-term picture. And I don't think that's anyone's fault, at this point, per se. I think it's sort of part of our society, the way we're always looking for Instagram and Insta everything and Insta fixes. And so, I think it was a natural progression that people would gravitate towards pills, both medical providers and people suffering with pain. But I think, what the book offers is a way to look at your own body and lifestyle medicine, integrative choices to help reduce pain. And it really does go back to nutrition and activity and sleep and stress and relationships and how that fuels inflammation. And inflammation is really what often causes pain. So if you just think about someone with, example, arthritis of their knee, the arthritis of the knee is always there. If you take an x-ray, it's always arthritic, which means some extra bony growth, possibly bone on bone in the joint. That arthritis is always there, but it only swells sometimes. So when does it swell? And that's when the inflammation levels are high. And so that's really what we want to go and sort of go upstream and look at the source of pain and try to quell that before it becomes a huge and chronic issue.
That's so true. It's weird, like we have some maybe defective place in our body or wound or scar or some, injury that's happened from the past, but then it doesn't always get activated. And I'm really happy that you're bringing this up because people need to understand the ways in which the things that they do on a daily basis actually can affect them. And, what about though, like if somebody's getting a surgery, right, where you have like a ton of pain after a surgery, you've had a crazy incision or a body part removed. I mean, just people have had some pretty interesting surgeries. The book that you've written, would that be for someone in a like kind of an acute state like that, where they, just have had something serious happen, or they've kind of like passed that transition point?
So it's really for both. I mean, you're 100% correct. If you have major surgery or procedure and you need a few days of a pain medication appropriately prescribed and monitored, through your physician, then that's reasonable, But if you're following the things that we are talking about today and that are in the book, then hopefully it'll help you reduce the dosage and the frequency and also how long you're on it. So I think it's for people, it can be an enhancement for people with acute pain. So I wouldn't say it's the sole thing after you've had an organ removed or a major surgery, but I think it's something that can be a helper and optimize your treatment and reduce how much pain medication you need, and hopefully therefore you reduce your risk of becoming dependent on pills like that. And then I think it's also for people who have ongoing pain issues, whether they're everyday or intermittent. And it's even for people who really don't have chronic pain issues, but are just trying to improve overall health, build resiliency, and like a lot of your listeners work on fertility issues, it helps reduce overall inflammation so that your body functions at its best level.
Yeah, I recently had a family member go through some pretty big health issues in which he was prescribed some oxycodone after the surgery, and we were all just so nervous giving it to him. And it was really interesting to watch how he was in so much pain. I mean, just horrible pain. And we were monitoring it and kind of guarding it and like writing down every time he got one to make sure that he didn't get too many, and that, because he was taking them sometimes, and we were really trying to keep track of it at home. And it became this thing almost where it was almost like, I think he started to get angry that we weren't giving him, whenever he wanted it, we weren't giving him more. Pain is so hard for people to deal with. It's like one of the most difficult things that humans have to endure.
It truly is. Yeah. And I'm sorry to hear about your family member going through that. It is a difficult situation because it's not like blood pressure where you can just measure it and say, okay, it's high or low, so you need this medication or you don't. There's so many different factors that are involved, including your previous pain experiences, people with pain around you that you've grown up around or seen, as well as other stressors, emotional and mental, that may be going on in your life that can all impact your pain level. And so, yeah, it's really a tricky thing. It's not a black or white issue. But I think, it's unfortunate because he was probably sent home with pain pills, but not with, here is a set of mindfulness exercises you can do. Here's a free app. Here's also a guide for sleep hygiene and better sleep. Here's a nutritious diet that can help you reduce inflammation. So sort of tackling all the other aspects of it and not just putting all our eggs in the basket of the pill and making people anxious and the family anxious and everyone anxious about the pills because that's all they have. And so it's sort of like we're leaving people, just with one choice, and then we're surprised when they become dependent on it.
Yeah, I think that's a really fair statement. The tools that people are getting when they're being sent home, and also the fact that oftentimes when a person's going through pain, they've just had something like it's a major disruption to their life even, sometimes it interferes with their work. And so there's even this whole fallout that happens after that. And all these recommendations that, you've given in your book about how to, reduce the pain, they're also the things that help a person be well, especially when they're going through something very difficult.
That's 100% right. I love the way you put that. I mean, these are really things you want to work on before you have a major pain issue, before you have a major surgery. So the tools are already there at your disposal, and you're not trying to learn them in the middle of, like you're saying, a life-changing moment. And, there's pain, which a lot of people define as physical sensations and discomfort, but then there's suffering, which is the mental and emotional overlay on top of that, as well as a change in your life narrative. So, for example, someone who has a major surgery and now they can't do the job they used to do, or they can't work in the same manner, like you're alluding to, that's a big life-changing moment for them. And so that can amplify pain, that can amplify inflammation, that can be really difficult. And it's similar for people with fertility issues. And I do have some experience with patients with fertility issues as well. And that's a life-changing narrative. Someone had a course and a plan in their mind of how their life was going to go, and it's not going that way. And the stress of that and the burden of that can definitely increase inflammation and can definitely kind of be counterproductive.
So how did you actually decide to focus on pain specifically? I mean, everything in medicine is hard, right? Because there's like a bunch of problems that you have to help people with, but like, why that one?
So I started out actually in physical medicine rehabilitation, and that's why I did my residency training. And that is sort of the field of helping people function better. So sometimes it's people who have had traumatic brain injuries or strokes or spinal cord injuries, but it's also people who have pain. So our goal is about quality of life and improving function. And so that's kind of where I started. And then from there, I did a pain fellowship. I also did acupuncture training because once you get out into the real world, you realize that we don't have a lot of tools. And, we're looking for things that are low risk to no risk, as opposed to a lot of pills and injections and surgeries. And so I got into acupuncture, and now I'm also taking part in some training for an integrative medicine fellowship. So I've really been trying to, expand the quote unquote toolbox to offer people more options that are evidence based. And sometimes, they take a minute. They're not the instantaneous relief, but they're definitely a win in the long run.
So you're launching this book, The Pain Solution. And I remember, writing a book and getting a lot of headaches when I was editing. I found that really ironic. Did you have any like pain come up? Because, when you're like crunched up at your computer all day, did that happen to you? Like any of those ironic moments?
Yes, they totally did. So I had two. I had one when I was writing, like you're saying, during the editing process, and it was just so much time with poor ergonomics and a lot of time sitting more than I normally would without breaking up movement, time. And yes, I definitely had muscle spasms at one point in my low back. And then actually a few weeks ago, my whole back locked up on me. And, it was kind of ironic. It was a funny moment. And when my back started hurting, my husband gave me the book and he said, "Here, you wrote the book on this." And I was like, "Don't make me laugh. It hurts right now." But, it was kind of ironic. And like, I had to like stop and, take my own advice for a minute.
So true. That typically, ends up happening when you write a book. You have to go back to and go, wait, what do I do for this? The way I wrote this actually, because I also kind of need this advice.
Yeah, exactly. And it's so practical and going back to the basics. And it's like, you think that, you can just sort of push through things. And, we need to like take care of ourselves if we want to take care of other people. It's just that simple.
So let's compare, because your focus is, you kind of straddle a couple different worlds because you've studied medicine from the sort of quote unquote conventional sense, but you've also studied acupuncture and integrative medicine. How would you compare the way that pain is treated in conventional medicine generally versus the maybe more not unconventional methods that you've studied?
Sure. That's a great question.
And I say unconventional because, like Chinese medicine's even way older than our medical system. So even the question sounds funny, but.
Yeah, that's really true. Yes. It's almost like non-United States or non-Western medicine versus like a lot of the rest of the world. But that's a really good point.
Yeah.
Chinese medicine and, expert on Ayurveda and Ayurvedic medicine. I mean, that's, thousands of years that's been practiced, and that's for good reason. But I think conventional medicine, unfortunately, there's a few issues. One is that when I was a resident, we were taught the 5 ways to treat pain. And, the first one is lifestyle modification. So that's everything we're talking about today: eating better, sleeping better, stress reduction, all of those things. The next way is physical therapy, then medications, then injections, and the last way is surgery. So there is that sort of stepwise, less invasive to more invasive framework. But if you're actually out in medicine and practicing in the, Western way and the way we practice here in this country, in the United States, they really gloss over lifestyle medicine, right? So that number one, even though it's listed as number one, generally it gets kind of glossed over because it involves a little more effort on both parties, on the physician as well as the person coming in with an issue, to be more active and proactive. And so it takes a little more time on both ends. And so we kind of jump right past that. And that's kind of a disservice to everyone involved. So this is sort of going back to, let's focus on the number one treatment for pain and really chronic disease in general, which is lifestyle modification. If you look at another aspect of Western medicine, it really focuses on sort of chopping people up by body part or body system. So someone in pain, they might have depression, they might have sleep problems, they might have some high blood pressure. They're going to get sent to someone for high blood pressure, maybe a cardiologist, go to a pulmonologist for their sleep issue, go to a psychiatrist for their depression issue. And I think all these specialists, they have a great role to play. So I'm not trying to minimize that. But I think there needs to be someone somewhere in the picture, one of these specialists or primary doctor or an integrative doctor, someone who steps back and looks at the whole person as well and says, well, look, these are all connected. This person isn't sleeping well because their back hurts, and that's kind of getting them down, start getting depression. Then they get stressed all day at work because they have a low tolerance for their pain, and then their blood pressure goes up. So instead of giving them, 3 different pills for each of those conditions, it's kind of like, let's step back and go back to the number one, back to the basics. Like, if we help improve this person's sleep in general, even without pills, talking about like sleep hygiene and mindset and relaxation techniques and building a sleep cave, we do all these things, that's going to help their pain. If they sleep better, they're going to have lower blood pressure in terms of more normal blood pressure, and they may not need their blood pressure pill after some time. And same thing with the other components of sleep and nutrition and exercise. If you focus on tweaking and improving those, and really in easy bite-sized pieces, that's the key. Not to be overwhelming or very expensive for people. Just simple little tweaks can make a big difference. Where, Western medicine's looking at us all chopped up, I think a lot of the Eastern philosophies take a better whole person look.
Okay, you brought up the blood pressure and pain thing, and I've always found that really fascinating. Can you describe how that works from a physiological perspective? How the pain can contribute to high blood pressure?
Sure. So if someone is in pain, that's a signal that something's wrong from your body, and it can activate the sympathetic or stress system, and that can result in increased blood pressure, increased heart rate, shallow breaths, and it can also actually hurt your immune system. It can mess with your hormones. There's a lot of things that happen when you activate the sympathetic system for a prolonged period. It's really designed to be activated for short periods where there's immediate threats. But with the way our world is and our society, it's often activated all the time, whether that's mental stress or physical stress from pain. And that really affects your whole body.
So you have these 5 steps that people should follow in your book. What are the 5 steps?
It's really a 5-step program. So it's based on Refuel, which is the food we eat. And then it's Revitalize, which is adding more movement to our day. It's Recharge, which talks about sleep. Refresh, which is stress reduction and mindset. And Relate, which is cultivating supportive relationships. Those are the sort of the 5 paths. And within them, there's little tiny steps that, again, are little tweaks people can make that aren't very difficult. I actually have coined a term called microboosts, which means a little step that adds up to big pain relief or big relief in general. So again, I'm not talking about a whole bunch of personal trainers and, private yoga lessons and a private chef. And for people who can, afford that, I think that's lovely. Go for it. But for most people, that's not really realistic. And so it's tiny little tweaks we can make every day that are easy, but really help add up to big pain relief.
I want to dive into this idea that your relationships and the way that you're relating with other people can affect pain. Can you give a couple of examples of that?
Sure. I think the best example is, the number one punishment for someone who's incarcerated or in prison is solitary confinement. I mean, that speaks volumes. We know being isolated or even just feeling alone, even if people are around you, greatly impacts your inflammation, your stress, and your pain in a negative way. And so we're human beings, we're social beings, we're designed to interact with people, we're designed to be in groups or communities, and that's sort of the way we thrive. And there's a lot to say. There's many studies about this. And there's the old adage, you're the average of the 5 people you spend the most time with. And so if you're surrounded by people who are supportive and help lift you up and have a positive, really optimistic outlook, that things are going to work out for themselves and for you, in general, you're going to do better with pain and inflammation disease than if you're surrounded with the opposite.
Wow. I forgot about that adage. What was it? You're the average of the 5 people you spend the most time with. That's really good reminder. Everybody, look at your friends right now. How do you want to be? All right. So would you say there's different types of pain that people experience?
Yes, certainly. I mean, there's acute and chronic pain is just sort of a general broad way to define it. So acute pain is less than a month and chronic pain is more than 6 months, and subacute's right in the middle of those two. But there's also neuropathic pain, which is more nerve pain, and nociceptive pain, which is more related to injury or organ-ish damage or injury. So sort of those are the broad categories, either neuropathic nerve pain or somatic muscle pain, or nociceptive, which is sort of, again, like organ damage or injury.
And so I think it was Rumi that said that the cure for the pain is in the pain. How would you interpret that?
I would interpret that taking it sort of pain as pain and suffering. So again, I think it depends on how you define pain. If you just define pain as physical injury, then I think that's a little harder to interpret that. But if you think of it as a suffering piece too, then I think there's something to that. I mean, if you have ongoing chronic pain and there's been given enough time for it to heal and you've been, evaluated appropriately with appropriate tests to make sure there's nothing dangerous going on, then it's kind of a message that something else is off balance in your body. And that's how your body is sort of alerting you to it, is through pain. You need to step back and take a look. Is there some kind of emotional or other burden that you're not addressing? Or are you overworking yourself? Are you not sleeping enough? Are you not eating right? And that's manifesting as pain.
So is that kind of more like when people say, oh, pain is like your teacher? Would you agree with that? Is that kind of along the same lines?
Yeah, I agree with that for ongoing chronic pain. Again, like you said, like acute pain, it doesn't really apply as much. But yeah, if you have lingering or ongoing pain, I think it is a teacher. I mean, it's been a teacher for me. When my back went into spasm a few weeks ago, I had to really think about, okay, how am I carrying my work bag? What are my ergonomics at my desk? How often do I get up from my desk when I'm at the computer? Am I eating the right things? Am I making sleep a priority? Am I sleeping on the best mattress? So, in that way, it taught me personally to focus on self-care that I talk about a lot and that I've enacted in some ways. But, am I doing enough mindfulness? Maybe with all the activities and all the obligations I've taken on personally and professionally, I need to do some more mindfulness than I do already and help ease the inflammation and stress to help reduce the pain. So I think it can be a teacher. I think it can be a path to healing.
Because it sort of forces us to look at our lives.
Right. To sort of pause and reassess and say, well, what is this signal coming from? Why is it coming? And what can I do to change it? And how can I make things better for myself and those around me by listening to this signal?
Oh, I like that. You said better for myself and those around me. Can you talk about that as well? Because you didn't say, how can I make life better for me? You said, how can I make life better for me and those around me? Does that added piece have something to do with how a person deals with their pain?
I think it does. Obviously, if someone's in pain, like, you're still talking about your family member. I'm assuming that wasn't today, but it's still on your mind. It still impacted you, that experience. And so I think when someone is in pain, it impacts everyone who cares about them. And it impacts everyone they interact with, depending on the degree of pain and how they're managing it. So it makes a difference. And so for some people, they don't want to deal with their pain or suffering for themselves, but they want to deal with it because it may help a family member, may make the mood and sort of home time better and less stressful. And you really can't contribute to your community or society if you're burdened by pain and you can't function. And that's part of our goal and purpose in life in some ways, is to, contribute and help and give and build something better around us.
I have a friend who is a pain doctor who doesn't have the integrative training that you have. And I was teaching yoga therapy in San Francisco when I first started my Ayurveda practice. And she sent someone over to me who was from her pain clinic. And I really had never specialized in pain. And so this was like a whole new world to me to see what, this person had been through, and having things kind of surgically implanted into his body to deal with his pain even. And I was just so baffled and just felt so bad for the guy. And one of the avenues that he had pursued was as a cannabis as a path for, getting away from some of these other more invasive methods that I was curious, like, which made it challenging, by the way, for me to do yoga with him because, when a person has that in their system, their physiology is very different. You have to practice a little differently. But what do you think about using cannabis? I don't know if you have a lot of opinions on it, but I was curious if you do. Or CBD or cannabis, all these different products of different variations from that particular plant family.
I think that it is a viable treatment option for some people. And I think people have to be careful about their source, number one. I mean, there's a lot of things you can just buy at, like cbd.com or something. I don't even know if that's a real website, but you really want to get these types of products from a reliable source so they're not laced with anything else, including like pesticides or other chemicals, which will actually do more harm than help. In terms of medical cannabis and medical marijuana, there's definitely like upcoming data that this is pretty helpful for certain types of pain. So I think it's a reasonable option for people as long as it's done with some kind of physician guidance if you're doing it for medical reasons, just to sort of help guide which products, because there's so many products out there. It can really be overwhelming. There's so many ways from topical to tincture to smoking. There's just so many ways to ingest it. And there's safety factors that have to be considered. So I do think it's a viable treatment for pain, but sort of with some structure and with some guidance. I think that's the best way to do it. I actually write about in the book that exercise releases endocannabinoids, which are natural activation of your natural marijuana receptors inside of you. So, there's ways to get that kind of quote unquote relief and high without actually using cannabis.
That's really cool. Yeah, I was curious about the CBD versus I've not really been able to understand how CBD, as a chemical agent on the body, like how it really differs from, having the other chemicals included. What is your understanding of how CBD works? And do you think it's really like legit versus the full kind of like plant experience?
Well, I mean, within the plant, there's different components. So CBD is a component and THC is a component. And THC is thought to be more of the sedating, kind of quote unquote, get into your head component. Whereas the CBD is thought to be heavier with the pain relief without having as much sedative effects. So in terms of medical marijuana, those are the two breakdowns. And if you go to, I'm in the state of Pennsylvania, so we have dispensaries here. And if you go to a dispensary, then there's different products that have so much CBD versus so much THC, depending on what you're looking for. So if you're looking for something at night, to help with pain at night, you might have a higher THC content. And then if you're looking for something to work in the day, you might want to have no THC and all CBD. So I think, there's different components, and the stuff and I know California has different laws, but the stuff that is widely available is from a different plant. It's not from marijuana. And so I don't know as much about the CBD component of that because honestly, a lot of that stuff is not studied and regulated. So we really don't know how much of what's in there.
Yeah, I've tried to study it from the Ayurvedic perspective, and there's some texts that I have from India, the Dravya Guna, which is the herbal pharmacology from the Ayurvedic system, and they have ganja and some other words in that, and it seems that marijuana is actually kind of a heating substance on the body, at least the way that the texts explained it. And, I haven't ingested it a lot since high school, so I don't really quite remember the experience. But I find that really interesting because I have noticed that a lot of my clients that have become habitual marijuana users, where they're having not just the CBD but also the THC, that they do have a lot of inflammation. And I don't know if it's because of that or other factors that what came first, the chicken or the egg. Did they start doing it because they had inflammation first? I was kind of curious, do you see any correlation? Or because in Ayurveda we try to think about everything from a very simple way. Is it hot? Is it cold? Is it sharp? Is it dull? Like these kind of qualitative measures. How would you describe that particular medicine?
So I'm not as familiar with all of the Ayurvedic descriptors and categories, but I think that it's a viable thing for pain, but I don't know about matching like someone's dosha to it and how, what people would fit best for it. I think that that's something that would be really interesting to study and kind of have it listed, that for this type of person, it would make sense to have marijuana with a higher CBD and a lower THC, or vice versa, depending on their dosha. That would be really cool.
Yeah, for sure. Like it's not necessarily a great medicine for somebody with a lot of the fire element or that pitta constitution. That was always my understanding from what I had studied. But it's something I've had a hard time finding information on. And a lot of my teachers, to be honest, like in Ayurveda school, people would ask a lot about it because I was in California in Santa Cruz County, and it's kind of a big thing that's part of the culture there. And there's a lot of hippies that gravitated toward Ayurveda, and somehow like marijuana and hippies go together. But our teachers, which they were all classically trained Ayurveda teachers from India, they were like, don't mess with that stuff. They were really resistant to talking about it, which was interesting. But, that's obviously not the case in America, and people are interested in other ways that they can manage their pain. And certainly the idea of, food and plants and things like this and lifestyle changes are things that people are becoming more interested in learning about. And so from the food perspective, I was wondering, how would you describe the way a person eats or what a person eats would affect pain?
Sure, that's a wonderful question. And I think it's something that's really overlooked. Unfortunately, if you go to a orthopedic doctor with back and knee pain, you're not leaving with a nutrition prescription, right? So that's not the first thing that comes to people's minds, but it actually makes a huge difference. So food and the American diet, the standard American diet, the acronym is SAD. And that's because it really is sad. It's loaded with processed foods, devoid of vegetables, fruits, devoid of a lot of plant proteins, and loaded with extra sugar and salt. And all of these things feed inflammation, which, as we talked about before, causes more pain. It's that example we started with someone has knee arthritis or an old injury, and it only bothers them sometimes, and that's usually when it's inflamed. And so the food we eat can either cause or lessen inflammation. So there's a lot we can do just with our diet to reduce whole body inflammation, and that can help with a lot of things, including fertility issues, including general health, including heart disease, diabetes. It can help with many things. And so it's really going for more of a plant-based kind of diet. And here's the thing, this is something I really delve into the book. I mean, it's easy to say I want to eat more veggies, but it really is not a goal until you have a concrete why, when, where, how, and sort of the whole how are you going to do it. So a better goal would be half my plate at dinner will be filled with green veggies. That's a concrete goal. That's something that's doable, it's achievable. You can pat yourself on the back when you're done with it, and you can sort of know that you're helping yourself have the least amount of inflammation and the best chance of doing well and living healthier. And so I think those are the kinds of things that make a difference, is having really tangible, easy goals that you can do every day with nutrition. Another one is just swapping out plant protein. So going for plant protein instead of animal protein at least once a week if you don't already sort of lean towards more plant protein. There's a lot of data that animal protein, especially if it's not high quality animal protein, feeds more inflammation. There's a lot of studies about how animal protein, especially poor quality animal protein, can feed more inflammation, and simply just swapping out once a week, once a day if possible, plant protein, and having that instead of animal protein can make a big difference on inflammation in general.
So can you really think of, you've worked with so many people now, I'm sure you have a story that comes to mind where someone just went through this miraculous transformation using the methods that you describe in your book. Could you share one person, their story that comes to mind?
Sure. So there was a woman, and she unfortunately, for multiple reasons, had to have both hip surgery and knee surgery. So she had surgery on both of her hips and both of her knees. And she had recovered. It had been more than 2 years. She met with her surgeon, and he had told her, all the hardware looks good, everything's in place. But she was still using a walker. And when she would use a wheelchair in the store, she would have her husband actually push her in her wheelchair. And she met with me, and we did a consultation through the Integrative Medicine Center. And we met for 45 minutes. And in that visit, I had her get up and walk without the walker. And it was just that little step, that moment of getting sort of out of her own head that she can't do this, that made a huge difference. So this started a year ago, but I still see her every few months because she really wants to stay on track with this. But she doesn't use a wheelchair at all anymore. She uses a walker sometimes, but is primarily using a cane. And honestly, she doesn't really need a cane. It's more just the fear that she has because she had so much joint pain before that she steps the wrong way, or if she overdoes it, she's going to go back to where she was a few years ago. And so it's sort of been doing little tweaks with her that we've been talking about, a little microboosts, and taking mini walks throughout the day instead of going for that, 45-minute, multiple mile walk, just doing 4 10-minute walks throughout the day. It's adding mindfulness to her day. It's talking about her ergonomics. It's changing some of the food she eats and meeting with our dietitian. It's all these little things have made such a big life for her. And she's literally gives us feedback all the time. She says that we've given her hope. But honestly, it was all her own work. It was all her own commitment to feeling better. She just needs someone to sort of give her some guidance in the how to. And that's what we did for her.
And I think that's pretty amazing. And I don't know that every medical professional understands the level at which they can influence even the mindset, because like the mindset has to change in order for the person to change. And that's amazing.
It's so true. There's so much. I mean, all of these things really can't happen if the mindset hasn't changed, right? If you don't think that changing your diet or sleeping better or exercising more is going to help you, then it's probably not. And, you and your listeners have probably heard of the placebo effect, right? Which is when a quote unquote fake treatment like a sugar pill actually results in improvement. There's something called the nocebo effect, and that's actually stronger than the placebo. So it's called the nocebo. And that's when you decide beforehand that something's not going to work for you. This is not going to help me. And that'll determine your outcome. So your mindset has a huge part as to whether you're going to get better and whether these things are going to help you or not.
All right, last question. What does the wisdom of the body mean to you?
That means that our body in a lot of ways can heal ourselves. And if it can't, it's going to give us the signal, like the pain signal, that we need to change something. The body's wise and it knows what it needs. It's just whether we're listening or not.
Beautiful. Thank you so much. Why don't you tell the audience how to pick up your book and how to connect with you so they can learn about how to make this a more pain-free world?
Thank you for having me. So the book's called The Pain Solution, 5 Steps to Relieve and Prevent Back Pain, Muscle Pain, and Joint Pain Without Medication. We can find it in indie bookstores. You can find it on Amazon, pretty much wherever books are sold. And I do have my own website, SaloniSharmaMD.com. And for daily kind of inspiration and motivation, probably the best place is Instagram, which is just at Saloni Sharma MD. I pretty much post every day with either something uplifting or some latest research or just a nature reset, which is just like pictures to sort of get your mind calm for a few minutes. So that's pretty much where you can find me. Thank you so much.
Beautiful interview today here with Dr. Saloni Sharma. Thank you so much for being here with us.
Appreciate it. Take care.
I want to thank you for listening to this show. It brings me great pleasure to provide this content to you. I also want to let you know that I'll be making some very amazing announcements soon. And if you're not already on my email list, then I encourage you to go over to my website and subscribe to my email list so that I can keep you informed about these announcements that are going to be coming up very soon. So my website is heathergrish.com. That's Heather, GRZYCH.com. And I look forward to getting these important announcements to you very soon and connecting. Thank you for tuning in and dropping in with us today. Don't forget to subscribe, rate, and review this podcast. I really want to hear your feedback. To learn more about my work, visit heathergrish.com. That's Heather, GRZYCH.com. And meet me here next time on The Wisdom of the Body.